Hey guys, Don here. Welcome to Podiatry Practice Mastery. Going over the $1 Million Minute. Kind of do a follow-up. I got an email from another doc recently. We were talking about, and you'll hear me ranting about stopping doing follow-ups for ingrown toenails. So I've stopped for paronychias, so I&D, nail avulsion, but a colleague kind of talked me into, or trying at least, not having matrix X's come back. So I made kind of a more extensive web page that I'm sending them, and I'm explaining to them it's going to be red, and we'll see how that works. I'll let you know if it backfires. So that was kind of note yesterday. I also visited some doctors, so it's a little bit of slower time. So I'm in my other office Monday and Wednesday, my new office, so it's still a little bit slower this time of the year. So I went and visited some doctors. I went and visited a nail salon recently that was nearby, and a Charles River group, which is a group of primary care doctors, and they have a number of doctors, and they do not have a podiatrist that work for them. We have a couple of big groups around here, like UMass is a big one. They have some podiatrists, not too many. Reliant, which is a big group, but they have podiatrists, and then there's these Charles River. So I went and visited them, had a nice conversation. It was interesting. When I went to visit, it's hard to get through the front door, which is never a comfortable proposition, but I stopped in. I'm just nice in general, I feel. And I put my cell phone, and as I was walking out, I got a cell phone call from the doctor saying, "Hey, are you still here?" So I went back and chatted with her. We were in the same residency in Worcester, Massachusetts. So, hopefully that'll turn into something. Today as a follow-up, I sent her one of my New Year's cards with the family because she asked what the family looked like. I didn't have something to show her at that time, so I sent her that. So I think it's going to be more than just like a one-touch thing. I think it's going to be a multiple-touch thing with this doctor getting new referral sources. I haven't had to do this for a number of years, but I'm trying to do it not only just for get practice, but to show that I'm doing it to the new doctor that's here, so that hopefully he will start to do that as well. Not a comfortable thing to do, of course. There's also another doctor that is in our building, and I went to meet her a couple of times. She's never there. She has a primary care clinic with two nurse practitioners, but she also has a cosmetic Botox type of clinic. And it's nearby our clinic, and so she's paying for two spaces. But when I went there, I was really shocked actually, because she wasn't busy. She didn't have an esthetician there all the time. She didn't really have anyone doing stuff, and she had all these really expensive equipment. So I really feel bad because she was struggling with patients, just needing patients. And she said, "Well, I just want to go there and work and do my thing and have someone send me the patients." And I just feel like there's a lot of podiatrists that feel that way. They just want okay, just give me a infinite amount of patients and then I'll just do my thing. And that's where I think a lot of these big groups, like the Reliance of this world, where they can just feed podiatrists and you can just work. And if you're in that gig, it's a pretty nice gig. You don't have to be nice. You don't have to do anything. You don't have to find your own patients. I'm just joking about the being nice thing. Okay. But you don't really have an ownership mentality, and if the flow dies down, you don't know how to get patients. And so I think this is where us that are in private practice, we have to or even direct care practice, you have to run after things. You have to be nice, be amiable. And to that point, the reason I'm doing this a little bit later on, so if you listen to this in the morning, you're probably listening to it the next day, is I had a coaching session. I told you I was going to try to find an orthotic coach. So I found this guy named Troy. Found him on Fiverr. You can find anything on Fiverr or ChatGPT. You can learn anything or find anything, but he's a kind of a sales coach. And I met with him this morning, and I did my recording of how I treat plantar fasciitis, just the first portion of it, and he gave me some feedback. It was frankly pretty painful. So I don't know if you guys want me to put that on the YouTube. I will. I recorded it, and I'd be happy to put it so you can hear him. I don't know. He was nice about it, but I felt like, my goodness, do I have a lot of things to learn? Because he's kind of a master salesperson. And what I mean salesperson, I just mean communicator. And what I realized is, and what he told me is, a lot of times I'm forcing the sale or forcing patients to do things too quick without enough empathy or building rapport. And it kind of threw me back a little bit. I felt a little humbled by this because I think we all kind of consider ourselves good communicators until you have someone watch you do that. So I think it's a good thing to kind of record how you explain things and have someone else look at it and give you feedback. That's what he did. So I'm going to do another session with him. But if you guys want that session, you think it'd be cool on the podcast, send me an email, don@podiatrypracticemastery.com, and I will put it there. It's an hour and 14 minutes. And we can, you don't really need the video because he's not really showing me that much I'll just put the audio on there if you want. If no one says anything, then I'm not going to share it just because it's kind of, how do you say it, humbling. But it was a good, so what did I take away? The main takeaways from meeting this gentleman was slowing down. I tend to go in there and do my presentation. I just want to rush through it. And then connecting and asking like more questions and getting more agreement along the way versus saying, we're going to do this and this and this, because I kind of have it all set out, kind of saying, okay, kind of being more laid back about it and not so forceful. So that was his take on it. But I know we're also stuck for like 20 minutes of time, right? We have to get in there, get out, and I know how that is. Okay, let's go over the Wednesday. This is a Wednesday I'm recording about. First patient, so I had 2 hours and 40 minutes of openings, so 11 patients. So I had a lot of open time. That's why I went out and did those things. Okay. So the first patient was a matrixectomy. She also had hammer toes, so office visit for the hammer toes and then the matrixectomy. No follow-up for this matrixectomy. So I'm trying this out. I talked to her, might get red, might get swollen, you'll be fine. If there's any issues, let me know. Next patient was follow-up after 3 EPATs. She's doing 100% better, and I did record a video with her. So I tend to record more videos when I have more time. So these are all in my YouTube shorts if you want to see those on my Dr. Pelto YouTube page. Next patient was a 9-year-old that I gave the options of Cantharidin and Swift, and they preferred Cantharidin. They weren't in a rush, and so they did Cantharidin and Aldera, and so that would be the prescription level 4 visit with a Cantharidin lesion destruction. Next patient was an EPAT. She was EPAT number 6, and I'm going to do a 2-month follow-up. So usually with EPATs, if it's 3, I do a 6-week follow-up, but since it's 6, I'm going to do a 2-month follow-up. Another patient was Q-Tenza number 1, and then another patient was EPAT number 2, blunt and fascia, and then I had a new patient came in with a distal fibula fracture. Got a cam boot from the urgent care. Came in, I put her in an even up because it threw her hip off. There's an even up, if you don't know what those are those things that go on the other shoe. All my patients get even ups. See her back in 6 weeks for a follow-up evaluation of that fracture. It's a pretty stable fracture, and she already held the cam boot. So I was able to get the fracture code from that in the office visit, and then the even up, not the cam boot. That was the morning. Then I went out a little bit and talked to people, and then the afternoon, I saw a patient. This was an interesting one, a dangerous one. 82-year-old female. She had some dry eschar at the tip of her ingrown toenail. It was really a vascular issue. She got a stent in, and I'm seeing her back, and she still has the eschar, still has the pain. I just told her it's going to take time for that ulcer to heal. So I did not do anything else. Another patient, this was a 62-year-old. Her name was Christine, and she got x-rays, level 4 visit because of the meloxicam. She had plantar fasciitis and some peroneal tendinitis. She's going to be doing deep tissue massage to that. And the great thing was, as I was leaving, Murali, my scribe, said, "Hey, Don, do you want to do a night splint for this one?" I said, "Yes, let's do a night splint." So there are some benefits, like Murali can also, or your scribe can produce your revenue, because he reminds me of ABIs, he reminds me of diabetic foot exams, he reminds me of night splints, and the things that I traditionally do, but sometimes you just get in a rush to do that. And then the last patient of the day, this was a follow-up nail removal. He is doing just fine for this ingrown. And then I went out, and afterwards I marketed. The doctor I met in my building, she recommended I go meet this other doctor that they did residency together. So I went and visited her, and then she recommended I come to one of their pod meetings, which is a meeting of all the primary cares. They meet once a month, so hopefully she'll invite me to that, and then they'll refer patients over. I asked her where she currently referred. There's an older gentleman that kind of trained me in residency. He's in Westboro as well, and that's where some of them are going, and then some of them are going to like a half-hour away to another city, and I said, well, just send them to me. So hopefully she will do that. I'll let you know how that works, but that was the day for yesterday.